somebody walks into your practice, say they're in their, I don't know, early to mid 30s, late 30s, somewhere around there. I feel like this is the age where people start to notice things changing. I, for myself, feel like around 36, I was like, oh, they're 36 or 37. I was still doing Botox at that time. Um, but that was when I really kind of think that I accepted like the aging was happening and things were changing. Um, so since you don't treat a number, if somebody is seeing things like maybe early jowling, maybe some drooping of the brow, what are you going to do first?
The first thing I always ask when someone comes in for a consultation is, what's your goal? And I think based upon that answer, then I really look at the face as a whole and look at the balance of the different features and what's contributing to whatever we're seeing. Oftentimes, and surprisingly, a lot of the jaw based aging that we're seeing, especially at a young age, like 30s, can oftentimes be to a skeletal deficiency or recession of the chin. And so, something easy there would be to place either a small chin implant. I much prefer that over filler, but balancing the chin can really make a difference in the jawline. With the brow, depending on what we're seeing, either something like it could either be volume based. So when you lose volume in the temples, the brows tend to drop. It could be due to someone just genetically always having lower brows. It could be as simple as using a few units of Botox around the brows to lift it, or you might need something surgical. So it kind of really depends on what I'm seeing.
What are the trends that you're seeing in surgery right now? Like, what are the big things that people are wanting to get done? I know a couple years ago it was probably like the Bella Hadid eyes, brow lift that, and Kendall. I mean, all of these girls kind of set this trend, allegedly, whether they had surgery or not, we're not saying. But that was kind of the aesthetic that everybody was trying to do. And people were trying to achieve that with things like threads too. And a lot of places were marketing threads and even brow lifts, surgical, as like the Bella Hadid eyes, cat eye, fox eye surgery, things like that. Are you still seeing that? Are you seeing like blephs? I feel like everybody is getting a bleph now. What are the big ones?
So I would say that there's definitely less people coming in looking for an exaggerated look. That being said, the patients that gravitate towards me don't typically ask for that, but I'm definitely seeing that a lot less on social media in general. I think what most people come in for is really more, how can I just enhance my features as opposed to I want to look like this celebrity. And so we really focus on that during the consultation. And I would say what we're seeing a lot more of is earlier surgical procedures, but minor. And so I think blepharoplasty, upper and lower, are something that I'm seeing patients coming in their mid late 20s, and then definitely things to improve the cheek and the jawline. So whether or not that's some sort of surgical procedure to lift. And so I created the Bijou lift, which is for my 20 and 30-year-olds and sometimes, late 30, early 40s, where there's not a ton of skin, but you are seeing descent of the soft tissue. It's not enough to do non-invasives. My patients in that age range feel like they're not really getting enough of a lift. And so I'll do small incisions, some endoscopic type incisions to lift and access the face and the jawline.
And is that mid face down or does that include the brow as well? Kind of the whole thing.
It really depends on the patient, but it can include the brow as well.
And you're doing that 20s and up?
I would say, yeah, 20s and up. And that's really, like you said, kind of 30s and some people in their 20s are really starting to see, signs of aging.
Do you think that some of that is because of people starting with these lesser invasive things earlier, like doing things like Ulthera, doing things like RF, maybe not getting it done appropriately, doing it too much? I mean, can that lead to some of this premature aging, do you think?
I think definitely for areas where people are going too deep with the RF and with the Ulthera, we definitely are seeing more skin laxity, volume loss, which can lead to early aging.